It is time for your weekend health roundup. We have our medical contributor here to talk about some of the big health headlines that are making news this week. Dr. Patel, thank you so much for joining us.
Gio, happy Saturday. I like your vibe, by the way. You look so cool and casual.
Well, you know, it's Saturday. That's what we do here. But you're not casual about the health news because the CDC is reporting that the first child death in this current flu season has happened here. So what can you tell us about that?
Yeah, it's a tragedy, Gio, because these are theoretically preventable with the vaccine and good hygiene measures. And we're entering a potentially bad flu season given this new variant, subclad K. The important news for people is that this year's flu shot can still prevent a serious illness or death, hospitalization in people. To make sure you get that shot to protect yourself and others. And as always, hand washing and staying home if you're sick can go a long way. This is on the heels of a horrific flu season last year in which we saw almost 290 deaths in children. We should not normalize these numbers.
Oh, yeah, just absolutely awful. And of course, we were thinking about that child's family. So the measles cases, we've been talking about this, Dr. Patel. They are on the rise in South Carolina. They're driving hundreds into quarantine right now. What's happening?
What's happening is that these vaccination rates throughout the country are lower than we need them to be. Gio, we were talking about measles, which is one of the most contagious viruses the world has ever seen. If you're not vaccinated and you come in contact with this virus, you have a 90% chance of getting it. We are approaching 2,000 cases this year. This is the third major outbreak. Measles is not slowing down, and we are at risk of losing our elimination status. You know, in some of these counties, the vaccination rate is still hovering around 90%, and that's still not enough to contain this outbreak, which can cause severe illness, even deaths, which we've unfortunately seen this season.
And before we let you go, Dr. Patel, we do have some good news. Thank goodness here. We hear that there may be another benefit to eating chocolate. Please tell me about this.
This might be one of the most texted headlines people have sent to me, and I love it. So what researchers looked at was a chemical compound in dark chocolate, the darker the better, called theobromine, and a potential association with high levels of this chemical compound and lower signs of biological aging. So these are markers in your blood that go up when you age. This doesn't mean that chocolate is a secret to longevity. It's fascinating science. And as I always tell people, everything in moderation, including chocolate.
Oh, absolutely. But you know what? Maybe not so much moderation this time of year. Dr. Alok Patel.
I mean, I'm proof of that right now. I'm proof right now.
Thank you so much, my friend. Great having you.